Hey, everybody. Welcome back to the Outcomes Rocket. So glad you joined us today because I have a special treat for you. Our guest's name is Ankit Gupta. He is the founder and CEO of Bicycle Health. He's super passionate about the power of technology to create patient-centered experiences that could deliver high-quality outcomes at scale, something that we need majorly in our health system. Prior to Bicycle Health, Ankit was co-founder and chief technology officer of Pulse News with over 30 million users and a shout out by ex-Apple CEO Steve Jobs. Pulse was acquired by LinkedIn and now serves as a LinkedIn newsfeed. Just an incredible entrepreneur, and I'm so excited to have him here on the podcast with us. Ankit, thanks so much for joining us.
Yeah, thanks for having me on board.
It's a true pleasure, and certainly looking forward to digging into the work you guys do at Bicycle Health. Before we do, though, Ankit, a great opportunity to for the listeners to get to know you better. What inspired your work in healthcare?
Well, I think the credit to that has to go to my wife. She is a physician trained in internal medicine. And when I was looking to do something that's a lot more impact oriented after my last startup got acquired by LinkedIn and got integrated into LinkedIn, I naturally got attracted to healthcare because of just the dinner table conversations and seeing the work that she was doing, both the amount of um, you know impact the patient, the people that she was helping, but also the challenges that she was running into. And actually, at her practice, about a third of her patients, sometimes even half of her patients, would have some sort of substance use disorder or some sort of behavioral health challenges. So that's what really motivated me, inspired me to start, meeting people in recovery, hearing their stories, and really trying to understand what we can do to improve.
That's awesome. Well, shout out to your wife for pointing you in the direction of healthcare. We need the brains to make a big difference. And now you're here.
And being my support system along the way.
Tell me
Uh,
about it, man. Hey, I'll take
Personal health care.
dude, huge, and I'll give a shout out to my wife on that front too. Can't do it without them. Incredible to have that support. So big shout out to our wives here on this episode. So let's hone into Bicycle Health. What does the company do, and how are you guys adding value to the healthcare ecosystem?
Yeah, so our mission is to address the number one public health emergency that exists in the country, which is the opioid crisis. And we're trying to provide high quality, convenient, affordable, confidential treatment for opioid use disorder. So millions of people are struggling with opioid use. The latest data shows that it's about 8 or 9 million people who misuse opioids in the country. And we help people get off of opioid addiction through a combination of medications, therapy, recovery coaching. It's a comprehensive care model, and really help people overcome withdrawals, help people get to stability. And that means they're able to achieve their hopes and dreams, achieve better health, achieve wellness, achieve closer connection with their friends and family, achieve financial stability, and really help people who are struggling with opioid use kind of overcome opioid addiction, get into recovery, and stay in recovery, prevent relapse for the long term.
Hey, I think that's very important work. We lost track of the problem for a bit because everybody was overwhelmed by COVID, but it never went away, and in fact, it got worse. So I think it's really great that you're honed in on this, Ankit. It's a problem. And so how are you guys different or better than what's out there already? I understand it's confidential. Is this direct to consumer? Is this you working with the plans? Help us understand more about the business.
Yeah, a little bit of both. So we are a virtual care model. We are the only national provider of opioid use disorder. So we operate in 48 states, and all of our services, whether it's medication management, psychotherapy, recovery coaching, care coordination, case management, pharmacy support, drug testing, all of that is delivered virtually through the app at home. And so that allows our care model to both provide really fantastic outcomes, but also fit into people's lives, which improves engagement, it improves adherence, to treatment. So our outcomes, which is primarily measured by retention in treatment, is best in class. So one, the care delivery model is unique. It's national. The second, we actually work with health plans in a pretty massive way. So we have contracts with all the major commercial health plans. We have Medicaid contracted in about half of our states. We're contracted with Medicare and a few managed Medicare Advantage plans. And so we almost 80% of people that come to us, we actually cover their insurance right now, and we're trying to increase that coverage more and more over time. And so that again allows patients to actually be able to afford all of our services versus having the financial burden and be able to again stay in recovery and utilize the comprehensive set of services that we have. And finally, one of the biggest challenges in addiction medicine is that there's a lot of stigma associated with
Yeah.
being in addiction. And my big hope, I think the thing that's really going to help us overcome the opioid crisis, is being able to address the stigma and being able to really diffuse the stigma. That's what we're trying to do with our advocacy efforts. But today, the stigma exists. And so people who come to us typically don't feel comfortable going to their primary care doctor for help. They don't feel comfortable going to their employer for help. Often they don't even go to their health plan for help. So they're struggling in silence, and reaching them through online channels we found it to be really effective to engage them in that confidential way, in that one-on-one way where no one really needs to know. And so we've built really robust direct-to-consumer engagement channels, whether it's through organic content, whether it's through paid. We've even started doing referral partnerships. Like we have a partnership with the Federal Bureau of Prisons. We have partnerships with several kind of large healthcare organizations. And so, we're finding ways where we can reach patients where they are and also engage them in a timely manner when they are ready to start treatment.
I think that's fantastic. And there's those online channels are fantastic approaches to reach people with high intent. Because I imagine you got high intent searches happening all over the place for help, right?
Exactly. And the intent is essentially trying to avoid withdrawal or trying to avoid relapse, right? These are searches around addiction, searches around how to get off of the medication, searches around the symptoms that occur when you're in withdrawal. So this is a time in the patient's journey where they're highly, highly motivated to start treatment. And it's almost impossible for a in-person model to be able to engage them at that time in that place that they are. Whereas through a virtual model, we're able to start treatment typically within 24 hours.
Wow.
And at most within 3 days is what our target is. And that's already too long. Over time, we want to start treatment within 24 hours for all of our patients. And so that, even that first step where you're able to reach out while you're in withdrawal and you're able to actually start treatment versus go out and get more medication is a huge, positive experience for the patient.
Yeah, for sure. And so then let's dive into the treatment. So tell us what the treatment is and what does that look and sound like?
Yeah, so patients typically get an assessment with one of our providers. We have a large full-time employed team of providers that are specialized in addiction medicine. These are MDs that are board certified in addiction medicine, or NPs or PAs who are supervised by our MDs. If the patient has an opioid use disorder, we typically prescribe a medication called buprenorphine, or the brand name is Suboxone. And so this medication can be taken orally. Patients typically go to a pharmacy after this appointment to go pick up the medication.
Cool.
Unfortunately, there exists stigma in the pharmacy landscape as well. And we've published some research where only about 40% of pharmacies actually stock the medication consistently. And so we've built technology to identify pharmacies that actually have the medication on the shelf. so that when patients go to pick up the medication, they're also able to pick up the medication same day. Um, so not only are they able to see us quickly, they're able to go and pick up the medication quickly, and then they start onboarding onto the medication. And we have uh, induction support in the app that actually helps the patient know how long to be in withdrawal for and what the right dosage of the medication to take at what point in order to onboard onto the medication. So that's roughly the first few days to a week where take some time to overcome opioid withdrawal, overcome the symptoms of withdrawal, and start taking this medication to start feeling stable and overcome cravings. After that, we complement the medication management through psychosocial interventions. So these would be recovery coaching supports that could be either one-on-one or in a group setting. Sometimes patients need therapy as well, and we have therapists on the team that provide one-on-one or group therapy. We also help a lot with other kinds of care coordination needs that the patients might have, like if they need referrals to primary care or if they need any other support in navigating their life and the healthcare system.
That's fantastic.
And then finally, we monitor patients through at-home drug testing. So we've built a randomized at-home drug testing model that actually allows us to monitor for adherence and in some ways actually performing better than in-person drug testing.
That's great. You guys have really taken this and thought about all of the places where drop off happens, right? And there's so many of them. And if you miss
Yeah,
one drop off, you're done. You're pretty much back on the drugs, right? Most likely. Um,
exactly.
so kudos to your team for thinking through this so thoroughly and thinking this is the person's journey. And I say person instead of patient. I think both
Yeah,
apply, but this is the person's journey through this very challenging addiction. And then Bicycle Health's there for you, and they kind of anticipate what you're going to need before you need it. They serve it up to you. This is sort of like what everybody's kind of wanting in healthcare, like hey, we want health like we want Amazon or Starbucks, and this is definitely serving it up, knowing where the truck is in your neighborhood because you're waiting for that
yeah,
particular package.
exactly. I think being patient centric or being user centric, that is quite important to be able to have people actually engage in the care that you're providing. And a lot of that comes from my background. Also, as I was in grad school, I took a lot of classes at the design school at Stanford. So user-centric design has been a key tenet of anything that I've built, whether it's my last startup where we try to make news reading a really sort of pleasurable, efficient, user-centric experience, or even in addiction medicine. And I think that is one of the things that differentiates us today at Bicycle, where we really try to create a user-centric experience throughout the addiction treatment journey, which is not the lens that I think most addiction medicine companies or even health plans or even regulators often take. Often the lens that they take is, here's the set of hoops that patients have to jump through, or here's the set of boxes that providers have to check off. It's typically more punitive, more restrictive, versus thinking about how do we set the system up in the best way to engage patients. That said, I'm seeing more and more providers, more and more regulators actually take a patient-centric approach. We now have Narcan that is readily available in pharmacies. We have low barrier buprenorphine access models that are up and coming and thriving in several sort of academic hospital systems. We have buprenorphine in the emergency room. So I'm excited to see more and more of this sort of user centricity, patient centricity in addiction medicine, because that's truly the only way we're going to actually help people overcome addiction, given the grip that these substances and behaviors have on us.
Totally. Yeah, no, I love it. And thanks for sharing sort of the why behind the user centricity. Makes so much sense. And so as you guys have built the platform, as entrepreneurs in healthcare, we learn and entrepreneurs in general, we learn and we reiterate. If you could point to maybe one thing that was challenging that you really learned from that has shaped what the company is now, what would you say that one thing is?
Oh my. Uh, you want me to pick one from like 100?
I know it's a hard one. It's a hard one to answer.
This might sound like a cliche, but I do think I there's a lot of talk about value-based care, and obviously there's a lot of talk about the financial model of healthcare driving behavior from providers and patients. I think being intentional about what the financial model is really important when you're starting a company in healthcare, especially a care delivery company,
Mhm.
and being thoughtful about choosing what financial model you want to go after. When we started Bicycle, we were really excited about the G codes that CMS had recently introduced that provides reimbursement for all of the wraparound care supports that patients need in order to achieve and engage in recovery, not just the medications, but all of the other supports that I mentioned. And we're now experiencing that there's some limitations to those wraparound codes as well. And a value-based model, a bundled payment model, an at-risk model, a lot of those models actually would allow us to provide the set of services we want in the way we want in an even much better way that would be even more beneficial for patients and payers. And so I think my advice and my learning would be to be really intentional about the financial model that you pick to build a company after. Now, the flip side to that though is the financial model does drive scalability of the business to some extent. The reason why we've been able to grow nationally, we've been able to see more than 30,000 patients, we've been able to contract with tens, hundreds of health plans is because of the financial model we picked. Whereas something that's a lot more bespoke, something that's a lot more untested, like a value-based model or a risk-based model, might be harder to scale. The populations you serve, the company you create, the impact you create might be different. So I think that's why being intentional about the financial model you pick and why, and being true to yourself about sort of what the other downstream decisions are that come out of that choice are really important to make sure entrepreneurs have their sort of head around when starting a care delivery company.
No, that's awesome, Ankit. Appreciate you sharing those learnings. And I did an interview the other day. A gentleman who's had multiple exits. He wrote a book, Can't Tame a Mongoose, and he called it the inevitable unexpected events that always happen, right? Like the
Yeah,
inevitable
yeah,
unexpecteds. And what you just
yeah,
shared is the importance of solid fundamentals, right? Like the and that biz that
yeah,
that financial model in a healthcare business, healthcare
yeah.
delivery is key. Go ahead. Go ahead. Do you have a thought on that?
There's so many unexpected. The thing that came to my
Yeah.
mind when you were sharing that was I still receive mail that I have to, you know, triage as a mailroom person, just
Yeah.
because my home address is on God knows how many forms out there. So maybe that's my second learning is really make sure your mail address is, a virtual scanning mail address that
Yeah.
does not change
Oh my
over
god,
time.
that's
But anyways,
oh, that's good. That's good. A lot of like you said, like before you, it's a tough one to answer, but I mean, in healthcare, the money trail is super key. Having those fundamentals in place, a huge learning, and then the unexpecteds that always come. Great
yeah.
share, Ankit. Really appreciate that. Okay, so here we are at the end. I know it's crazy. Time flies, but if you if you wanted to give our listeners a call to action, what would that call to action be today?
Like I said earlier, I think the biggest challenge in addiction treatment is actually the stigma of addiction that we hold in our culture. And it's quite natural to have stigma. I think the call to action would be to try to understand addiction more. A really good book that describes the opiate crisis and why we are here and what we can do is Dreamland by Sam Quinones. So if that's something that your listeners haven't read, I would highly encourage reading that book. But
By
honestly,
Ankit?
just learning more.
Who's it by?
Sam Quinones.
Sam Quinones. Okay, cool, cool. Yeah, we'll link it up in the
Yes.
show notes for
Yeah.
sure.
Yeah. No, it's a great book. It's also quite sad and heartbreaking, but really portrays the reality in a sort of raw way. And I think the more I meet people in recovery, the more I learn about the science of addiction, the more I notice addictive behaviors in myself, whether it's coffee every day or working over Christmas break. I think it helps me empathize with addiction and people with addiction and see addiction in a much more sort of commonplace way, which will really help us support each other as a society. So yeah, I would say learn about addiction and meet people in recovery and hear their stories and see if something lights up in your brain.
No, I think that's great. Get great call to action there, folks. Definitely think about that. I definitely am. The only way to combat this type of stigma is to really give it some solid thought and not just have knee jerk reactions around it. That's the only way we solve it. I remember going to a man back when they used to have TED Health or TED Med. They don't have it anymore.
Yeah.
The Surgeon General gets up on the stage and talks about his brother who had the issue. And the other thing is just being open. I know it's not easy, but sharing stories is another great way to kind of get what Ankit's getting after here. It's normalizing this big problem. So Ankit, thank you for that call to action. Where can people find you, and where can people get more information about bicycle health?
Yeah, you can visit bicyclehealth.com to learn more. We have an active Twitter account. We have an active LinkedIn account. I guess it should be called X now. I'm pretty active on LinkedIn, so you can connect with me there. My email address is ankit@bicyclehealth.com. So feel free to send me a note. I'm always excited to meet fellow entrepreneurs and healthcare, folks.
Love it, Ankit. Well, folks, there you have it. Mr. Ankit Gupta of Bicycle Health. We're going to leave all of his contact information for his company and him in the show notes. So take action. That's how you get the outcomes you're looking for. Ankit, thank you.
Thanks a lot.